ramps up as more people want to know if their immune system can fight off the novel coronavirus. And that's where we begin. Some doctors are opening their doors to meet this need. Channel 3's Travis Cummings spoke to a doctor in Dalton about antibody testing.
This drive-through was once used by a bank here in Dalton, but now it's used by a pediatric office. And this week it turned into a hub for screening patients for COVID-19, giving them what medical staff here say a peace of mind.
It's a new disease, it's a new test. People want to know what their options are. Have they been exposed? Could they be at risk right now?
With antibody testing on the rise, physicians are slowly opening up their doors to patients for that purpose. At Bright Pediatrics in Dalton, they use their contacts in labs overseas to get the resources needed to get antibody testing going.
So the first shipment came in April 1st. That was about 600, and that went very quickly. Then we got our second shipment last week of 400, and it's completely out.
Dr. Rami Azuz and Chief Medical Officer Andrea Azuz turned their building and its drive-through into a hub for antibody testing.
I would say around 10–15% of the people we screen, it came back positive. That means they have a history of the disease.
They showed me how the test works.
This is the control line. The control line has to show up. This is the IgG and the IgM.
A poke of the finger allows a physician to check your blood for 2 antibodies, which show if you have previously been infected by COVID-19.
And it's quick, takes about 15 minutes.
It's different from the swab test you receive when tested for COVID-19.
You don't go deep in the nose and you don't stay for 20 seconds. You know, it can be false negative.
Azuz described a 55-year-old patient
Being tested twice by the nasal swab, the PCR one, and came back negative, and he refused the third one. And he came here, both of his IgG and IgM came back positive, which has mean really he's still fighting the infection.
They say the goal here is to give medical staff and patients more information in the fight against the virus.
You know, the knowledge is power. The more we know, the more we're able to fight this disease. And
We cannot work as a physician without testing. I mean, testing really important.
And Dr. Z says although testing is available, it is important to continue practicing social distancing and using personal protective equipment like masks to help prevent the spread. He says although Bright is out of tests right now, they will resume to help the community soon. He says that the test is about $50 out of pocket and only select insurance is available. It only takes about 15 minutes to get results and no appointment is necessary. Reporting in Dalton, Travis Cummings, Channel 3 Eyewitness News.